This conference will now be recorded.
Hi, everyone. We'll get started in about 5 minutes, if that's okay. Okay, hey, everybody. It's Mitch again. Thank you for coming. We're going to get into this and get started right away. I'm going to start by, of course, sharing my screen If you have any problems not seeing it, please let me know. And for 1 second, if you can see my screen currently, would someone, Heather or somebody, just unmute and tell me that, please?
It's there. I see it.
Okay. All right, let's get into this. This is part 2 for Access Laboratories evaluation of toxic metals. The very first part was meant to introduce you to what a toxic metal is, how pervasive it is, what some of the damage that it can do, and why there should be widespread testing of a toxic metal, especially in an integrative healthcare practitioner's plan, because if he or she is not able to remove the toxic metals, the chances of failure are certainly much, much greater than if you did attend to these toxic issues. Tonight's different. Tonight's part 2. By the way, if you missed part 1, you can always call Access your representative, and I'm sure they'll get you a copy of it. We do have taped it like we are tonight. But tonight is more about different symptoms, first of all, that may be in common of the different common toxic metals. I'm not going to do all of them. It's way too much, and most likely won't remember them. But the concept is how many of these non-specific symptoms may be representative in some sort of toxic metal overload in your patients. We're going to also talk about how we were exposed. In other words, how do people get exposed to these particular metals? And I think that will help you. We'll talk about some of the physical exam signs. In other words, what you should be able to see in some of those type of things. And then we'll talk about which different systems of the human body are affected by poisoning, also giving us sort of a roundabout way of looking at what types of symptoms someone will reproduce to begin with. And then we're going to talk about how to read a report. In other words, how are we going to read a report? And then we'll be pretty much call it an evening for this part 2. So let's get started on this and see where we can go. So here we start with, how did we get exposed to the toxic metals? What are the symptoms? What's the impact? What testing? What are the challenging agents that we're going to use? Now, up front, you should be aware there are probably 200 plus chelating agents for the most part, with the exception of about a half a dozen to a dozen. The others are toxic and are not used specifically. So we'll just talk about the ones used. I will give you how to use them in a testing manner tonight with the dosages. In part 3, we'll talk about how to use them and other things as part of a detoxification process when it comes to toxic metals. So to remind you, our exposure to metals are so many things. As you see on the right upper corner, lipstick, they've looked at like 22 red or lipsticks. Pretty much all of them had lead in them. The amalgam fillings you see on the bottom. Fish, of course, for organic mercury. And then, of course, medicines, vaccines, etc. And so these are some of the exposures that you should be aware of. So it shouldn't surprise you that pretty much every patient that you come in contact with is going to probably have some toxic metal to some degree in their system. We also made it very clear in part 1 that no matter how much you have, even small quantities, they have some significant physiological consequences. So let's see where we're at. So in general, first of all, some of the toxic metal poisoning symptoms are diarrhea, nausea, vomiting, shortness of breath, tingling, chills, weakness, brain fog, confusion. Now, I know you're sitting there probably thinking, okay, I can probably think of 10 other items for each of those categories that can cause this. And that's correct. That's because much of this is insidious. Much of this is very difficult to diagnose. And unless you're willing to take the time to really do an amazing exam physical and use it by exclusion to figure out there's a toxic metal, the best way is going to be, obviously, is to test for them using a challenged agent, which we'll talk about in a little while. So let's specifically hone in mercury poisoning. Now, mercury poisoning, of course, it's a neurotoxin. We did talk about, perhaps this last time, there is no real half-life of mercury. Mercury's life is as long as the body does not remove it by its normal detoxification processes. So you can see any of these type of things, from lack of coordination, muscle weakness, all sorts of neurologic problems, things that you might expect from many other processes as well, except, of course, this will be ongoing. And if the exposure continues, then of course the amount of symptoms will actually increase, if not worsen. Lead looks a little bit like this. From constipation, as you know, lead passes the blood-brain barrier, as does mercury as well. Both mercury and lead are part of the vasotoxic metals, as we discussed in part 1. But increase in blood pressure, early death, etc., was also talked about, and we can see a lot of these symptoms occurring in this particular toxic metal. In arsenic, we're also looking at the similar nausea, vomiting, diarrhea. Again, in part 1, we did mention that arsenic toxicity can be now and not do its damage for years. Arsenic's also related to increase in breast cancer risk and bladder cancer risk as well. So these are also some of the things that you see in arsenic. One of the ones that's very common that you didn't see in the other is both the heart dysrhythmia and muscle cramps. So just make a quick note about that as well. Now, cadmium also, which is a vasotoxic metal, you'll see again some of the similar ones like fever, breathing problems, and muscle pains and aches. Again, it's similar to the others. It will be easy to discern once you're able to look at a testing pattern and know how to order a test and how to do it properly. So how do we get exposed to some of these agents? Let's start with arsenic. So if you live near a hazardous waste site, being in areas with high levels of rocks, water, soil, for certain are also arsenics. It is in pesticides, herbicides. You don't have to ingest them. If the things that you're eating are not organic, then you run the potential of having arsenic in them. You can eat contaminated seafood. It's not just eating seafood that's contaminated. Pretty much all of seafood's contaminated. So as we talked about before, when you do some of the testing, which you'll see later this evening, please make sure that you ask patients not to eat seafood for about 2 or 3 days. Stay away from apple juice and rice, both which may contain some amounts of arsenic, but because we're measuring in small quantities, it may skew it to look like they have more than they really do. And of course, contaminated water. So how do we get exposed to cadmium? Well, it is part of industrial smelting. It is in welding. You also find cadmium pretty much the number one way is in patients or people that inhale cigarette smoke. This just does not mean the primary smoker. The secondary smoker can get cadmium, and the tertiary person can also. Now, tertiary smoke, just to remind you, is that which falls on clothing and or furniture. Kids sit on it. Their immune systems and their capability for detoxification is certainly not mature enough to get rid of these things, and they are much more likely in tertiary smoke or areas where parents or families smoke to get it on the chairs and things, and they in turn will get it through the skin. So how do we get exposed to lead? Now, these are not exhaustive lists, but they're the ones that are the most common, so that you can make a copy of these. You can go online and find them, but certainly you'll be able to speak to your patients accordingly. Lead-based paint would have been a while ago, but there are still people that are buying older homes. My wife and I recently bought a ranch from 1974. It was one of the first things I thought was there lead-based paint at that time, but it had been changed. Radiator repairs, not much of that. But the next one is gun ranges. Many people nowadays are practicing target shooting, etc. Many of the lead jackets give us high exposure to lead. Remember, you can also inhale a toxic metal. So places like gun ranges that are indoors, although it's always better to shoot outdoors, the indoor ranges often do not have a good ventilation system, and therefore you're breathing it in. So even washing your hands real well afterwards, you might have still inhaled a somewhat significant amount of lead. Kohl cosmetics have been shown to have lead in them. Hair dyes you probably are aware of. Some calcium products have lead in them as well. And we're talking about calcium products. Why would that be? And that's, of course, because they come from bones. And hence, prescribing for patients onward and forever, bone broth, etc., you're probably giving them a level of lead. So you may want to do if you did tend to use it for some length of time, testing after you've had them on bone broth for some time. Porcelain is a issue as well. One, not because so much, but any case, there are porcelain plates and things of this nature, but more importantly, it's in crystal too, but they also use porcelain dental types of things. Most are getting away from the amalgam silver fillings and replacing with either methyl methacromate, the white filling, but also they're using porcelain, which is a lead source over time in the mouth too. Mercury, of course, is in mining. Pretty much anyone that lives in the United States, man, woman, or child, gets about 0.6 of a milligram just by breathing in the air every year, just from the medical burning and the coal burning plants that are left. Now, there's less and less all the time, but they still produce mercury. Of course, the organic mercury is from consuming fish. The larger the fish, the more likely they are to have mercury. You can certainly always look up. The larger fish, the predatory fish, are certainly the ones that carry more mercury than the ones that are not. And of course, iridescent lights do, and mercury vapor lights, as you would see in gyms. They're going more towards LED now, but still there are mercury vapors around in that. Also, mascara, like oil-based mascara, is an issue for mercury. And again, the thimerosols are mercury. And again, this is not an exhaustive list, but at least one to give you an idea, a concept where you can start looking for these patients. Let's talk about a physical examination. You should be conversant in this. This is important for you to know. The very first one in arsenic and when the poisoning goes on is something called Mees lines. If you look carefully at these nails, you'll see the Mees lines right here. These are horizontal white lines that occur on the nail itself. You have to be careful you don't confuse these with a trauma line, but these are lines that you'll see on all the fingers as opposed to trauma typically is on one or two. You also, if you have an EKG and you start to wonder why someone has QT prolongation, neuropathy, and of course a garlic-like breath odor, you probably won't get close enough to the patient to do that. So the Mees lines may be your first telltale, at least sign. In the gums on lead, you will get a purple bluish line. It's called a Burton line. It's different than amalgam tattoo. In Burton line is like a longer line, a bluish line. It's on the gum. Yes, you can get cognitive decline and a fourth nerve drop, palsy, and get a perineal foot drop. But the bluish line in the mouth, you should see if you do a full exam. The amalgam tattoo is different. The amalgam tattoo, if you look at a tooth and the amalgam that goes around the tooth, you'll see that whole area start to get bluish around it, as opposed to a line, which would be more like lead. So look for amalgam tattoos. They're very difficult to get out. Some of the organic dentists say they do and can get rid of it, but it's an obvious sign that that particular a thing in the mouth is leaking. All right, so iron, someone may produce an anion gap acidosis, which you may not obviously be familiar with seeing, but certainly you will if you are doing correct blood work, which hopefully you all are doing a comprehensive panel. You will note a elevated ferritin level. You should be doing ferritin anyway for many reasons. Not that this is a component of, but it will help you determine if there is iron overload. And of course, the chelator for this is different than the others that we will present tonight. The chelator for iron is desferoxamine. forgive me if I didn't spell it right, or it's also known as Desferol. That is the iron chelator. And if you check iron or ferritin, you'll know there's an issue because it is a major important test for people that have COVID. It's a very bad prognostic sign, especially when it goes over 1,000 or 1,200. It comes back on its own as the patient recovers. It's also a bad sign if someone has it outside of that particular disorder because it demonstrates oxidation, significant oxidation. And for a cancer patient, it's a very bad sign as well because the cancer sequesters the ferritin into the bone marrow. So if you're not doing ferritin levels, I would suggest it would be good and be added to your armamentarium of your comprehensive blood supply. Let's talk about some notes for a minute, and then as we get closer to looking at how we do this test, you first need to remember there is no safe level of toxic metals. It just does not exist. And that we showed last time, but it's worthy of repeat and honorable mention in this one too. The report we're going to look at is not a challenge chart. Now, you'll see what I'm talking about. When we look here, it's reported out, you'll see different colors. Those colors are meant for a non-challenge test. What's a non-challenge test? It means just the urine was collected for whatever amount of time we collected for, which we'll discuss. An aliquot was sent off, and then it was determined whether there was any toxic metals. You get back a report. That's the color chart's based on that. It is not based upon, when you challenge it and saying, oh, look how much you have. But I will tell you how to interpret it. You need to know this. It's very important because if you're ever challenged, you need to know and understand how the chart is read. The third thing, which I will say another time as well, there is no test for total body burden. There is no test that we can do and say, oh, you have 18 grams of mercury, you have 32 milligrams of lead. There is no test. The test is done by hypothesis, by reductive analysis, and specifically by extrapolation of the data. I will show you that in a minute, which brings that point up. For a couple other notes that you might want to look at is if you have mercury and cadmium, both of them, they will compromise your immune system. So if you want to memorize something else tonight, as I will tell you the few things you do, you should be aware when you see mercury and cadmium together, both which, by the way, are vasotoxic, you have a significant vasotoxicity, and you have an immune system also that will be compromised significantly. So in this day and age with all the immune compromisation, have you done toxic metals on these patients? I'm going to make the assumptions that yes, because you're all smart, but if you haven't, it would be a good idea. You be aware also that even mercury, we talked about lead before, even low concentration in parts per million will downgrade your health. We're talking not only neurologically, we're talking immunologically as well. So these two are pretty much watch fors. Now, of course, if you have lead, it does disturb the GABA balance. You wonder why someone's not sleeping good, your first thought. Then a good one is their progesterone, if it's a woman, is low. You provide them the repletion with progesterone. Good for you. You did an amazing job, but they aren't getting better. Do they have lead that's going through the blood-brain barrier and is disturbing the production and secretion of GABA? Well, maybe you need to look. And if you have both lead, cadmium, and arsenic, you will disturb dopamine. And one more thing as I make this closing remark on this particular slide, if you have mercury, lead, and aluminum, you're going to just disturb acetylcholine. So here's the whole story. Neurotransmitters are significantly affected by having even low concentrations of mercury, lead, cadmium. So if you see them even in low quantities and you're saying, gosh, we don't have a ton of this here, but I have 2 or 3 of them, should I still remove them and do some sort of chelating procedure that we're going to see and learn in part 3? The answer is yes. And again, if you're not testing for it, you will not know. And when you have a failed case of not sleeping or immune deficiency, you may not realize that it was right here in the palm of your hand that you learned just now tonight. So one of the things, these are just some back-end notes that you should be aware. Mother to baby transmission of mercury has been well documented. As a matter of fact, they did a study, the Environmental Working Group, they took 100 babies, each of the umbilical cords, all 100 had mercury in them. Vaccinations are clear. The thimerosal is a mercury source. It has aluminum as well as one of the preservatives. Dental amalgam fillings don't need any more presentation than we did the first time, and birth control pills, but that was back in the 80s. And lead, there are still some old toys around. They try to get it out. We did talk about lipsticks. Primarily the red lipsticks are the ones that carry the lead. Pretty much in all baby food, there's lead. Yeah, toxic metals of different types. So if you have a child or grandchild, then you should encourage either your children or your grandchildren's mother and father to please try to use organic or make good food for them, actually making the baby food, which would make sense. And of course, metabolic syndrome is also attached to toxic metals. So while you wonder why someone's getting diabetes or why someone now is not the same, or they have A1Cs, hemoglobin A1Cs that are going up, they may just be having toxic metals that need to be reduced. Also, in your actual protocol for individuals that you're giving diabetic support to, whichever using conventional or nutraceutical or a combination of both, having the presence of toxic metals is going to impair your improvement in that person, because it does increase and does worsen metabolic syndrome. All the reason more to test. So let's talk about the impact of these different things on the body. Unfortunately, it hits every system. And you'll see over the next 2 to 3 slides that pretty much every system is involved. The immune system, it does involve autoimmunity. And what do you do when there's autoimmunity? You try to balance their hormones. You try to get rid of the toxicities around them. You try to fix the radiation they're exposed to. You get the gluten out. You do all those things that you've always been trained in. But you also have to realize there is toxicity from heavy metals or toxic metals that may be interfering as well. Did you test for it? If you didn't, you should. Of course, in multiple sclerosis and pretty much most of the nervous system diseases, it may not be the initiating factor of, let's say, having mercury, which can cause neurofibrils tangles, but it could worsen, increase, or enhance the actual progression of that disease. So it would be another good reason. The endocrine system, similarly, from the adrenals, fertility, and things of this nature. Cardiovascular, well, we've already told you that, both part 1 and earlier this evening, in showing you that lead, cadmium, mercury, even gadolinium, which we have not and probably won't do much of tonight, are responsible for arteriosclerotic stroke and other CVD problems. Cancers, we did talk a little bit of a couple with arsenic already. These are all part of toxicity of toxic metals. Does it make sense yet? It should, that this should be part of your initial workup in pretty every patient that comes in. And as you see these different things, you'll see now there are chemical compounds that act as mitochondrial toxins and poisoning, and they will cause mitochondrial dysfunction and disease. There's not one person on this webinar tonight or anyone that watches in the future that has not been up against mitochondrial disease and toxins. Many medicines are. However, if you already have on board toxic metals and then you have other things, it's certainly going to worsen this potential chance of someone ever getting back their energy and ATP proper delivery and amounts that should be given. Immunologically, you're going to see white blood cell function falter, allergic reactions and sensitivities, and all these things that we basically went through already are going to be on your plate for you to deal with these patients. So here's some of the immunotoxicity. What happens? Often you start to get allergic symptomatology and food and environmental allergies. And of course, the minute we do that, we start running every allergy test under the sun, and we look for all these things and that can create these problems. One of the things I would like to just put your mind to for 1 minute is this right here, which is the diminished natural killer cell function. In our office, and my PA that's on the line with me, who's phenomenal, we do testing of the immune system very often, very often. There is unfortunately many patients that are suffering from immune deficiency type syndrome secondary to getting immunized. This new immunization, we're seeing it many times in patients. We see that even the levels of several of these immunologic T cell helpers are falling below even AIDS patient levels. So if you want to look at just the toxic metals in this case, because this is our review for this evening, you will see diminished NK activity. So someone may be saying, okay, how would I know it? How do I test it? So you can always test NK activity by doing two things. You can test, first of all, the amount of them. The amount of them is asking for a CD16 and a CD56 count. These two are the natural killer. These cluster designations, 16 and 56, will tell you the amount. This is a, the quantity. This is a quantitative thing. The quality is the NK activity. And that you have to specifically ask for the test for an NK cell function study. And what I do, we ask for both simultaneously, but you're going to find that in toxic metals that either this can be low and or the function can also be blunted as well. You're also seeing in these environmental toxins, neurologic, and the brain fog. We went over that earlier. Pretty much these are just being repetitive of what we said earlier. We're not going to belabor it any further. I think it's obvious. Pretty much every system, including the skin, which can get rashes and all sorts of bullous eruptions from having too much of these toxicity, pretty much every system is involved, psychiatric down the line. And again, you're going to see things from sensory changes to brain fog, mood, and everything else. Again, pretty much what we've talked about. And then we're looking at the endocrine system, and these things can mimic hormones. Now, that's an important point that we should step on for 1 second, because if these things mimic a hormone, then not only will it do the damage that it's doing to the target organ that it's in, it will have secondary effects in reducing or decreasing the hormones, which we showed a little bit earlier. But again, this underscores it and basically says to you, if you want to get good hormone control, did you check the toxicity of the heavy metals? It makes sense, because that's what we're trying to look at. This is the second thing on here, is basically saying the same thing we said earlier. It may stop the body from being able to eliminate even the excess hormones as well. So you may create a toxicity from that. The endocrine also shows some more symptomatology. One of the ones that people are not thinking of, unfortunately, I do the same, in that when you have someone and you, a male or a female, and you've put back testosterone because that improves the libido and so forth, and you still somehow don't have that improvement. You tried these other things, you've tried the polypeptides, the PT141 melanotide, and everything else you might have gone to. The problem is, if there is a toxic metal, you may have these issues. That should be in your head. So when there's a failure, at least go back and look at your toxic metal. If you haven't done it, then of course do it. And these are some classic presentation. There's a few things that on here that are worthy of pointing out. One, of course, that people who are very sensitive to caffeine, especially the ones I can't drink in the afternoon, caffeine should be out of the system in 3 or 4 hours. The ones that can't excrete it because of what the liver is not excreting it well, they may have a toxic metal. So that's one thing when they tell you that. If they're telling you they have multiple chemical sensitivities, they're sensitive to botanicals, all these things, asthma and so forth, then these would be the people that you might be thinking, is there something going on when it comes to a toxic metal? When we test for toxic metals, we have to ask the questions. Here's the part of the conversation this evening that will make the difference whether you do this correctly or not. So hopefully I'll be able to lead you in the right direction. Toxic metals, you have to ask the questions. When should you do it? How should you do it? When do you repeat it? And the challenging agent. I'll skip to when to repeat it first. It'll probably be the easiest. If you do toxic metals today, day one, let's say, and you are going to treat it, which I assume you will, depending on your treatment mechanism, if it's oral, then you probably won't want to recheck for somewhere between 4 and 6 months, because you can't go too fast when it comes to removing toxic metals because of the potential for creating more problems. If it's intravenous that you're using, which many of you are and will, then you can always repeat at about somewhere between 15 and 30 doses. Now, we'll get into that next time, but I just wanted, because it's on this slide, to get into it with you at this point. So from day one, you start treating is when you'll decide to repeat, or if you're having a failure, not doing well, then you'll be repeating before this. So when's the best time to do toxic metals? The best time to do a toxic metal testing happens to be in your very first visit. This would be, for me, a first visit add-on. And they're not overly expensive. We'll talk about how we had access to them, but it's worthy of you fitting that into your schedule and doing it with the patient from day one. If you explain even 1/10 of 1% of what you've learned between part 1 and part 2, the patient will be gladly and want to do it. The how is what we're going to discuss now, and the chelating agents, that is what we were going to discuss now too. So you have 3 good choices. There is another choice, which is called fecal matter. You could do that. There are fecal tests, but let's discuss these. Let's get them out of the way. Let's talk first here about the hair mineral analysis screening. I've done thousands of them in my career, thousands. However, the government, about 2005, about 2005, found that this only is a screening test. It's not a real good definitive test or give you as much information, and you could get a little bit of blowback or pushback over hair analysis screening, and you're treating upon this alone. This is used heavily, like for the Alaskan state, and many states use it to test moms that are pregnant for mercury intoxication. It's a nice screener, it's easy, but even if this is not done right, it won't be any good. So for a moment, I will tell you, if you decide to do hair mineral analysis, we do not do it at Access, but that's okay. If that's important to you, you should be aware that if you don't do it with what I tell you now, it's not going to help. So hair mineral analysis requires 3 days of washing the hair. I would usually tell people to use baby shampoo. The baby shampoo will remove most of the residues. When they come to your office after that, they need to get to the office. Hopefully it's not too far, because there's over 3,000 pollutants in the air. The second thing that you want to do is, of course, you want to take the sample as close to about 1 inch away from the nape of the neck, so that you get an honest finding. Remember, if this person has used any hair dyes, any curling type of things, any type of conditioners, hairsprays, anything that day, then it's no good. They can't use it within 3 days. Otherwise, you're getting a skewed test because they have toxic metals in them. Okay, so as I said, I've done lots of them. I haven't done them in a long time, or years. So let's go and jump to the first one, blood mineral analysis. You could take serum, or you could take whole blood. So let me give you the positive and negatives of both. So in the serum, the problem is toxic metals don't last in the serum very long. They typically will distribute from the serum into their respective repository areas. So, for example, the longest lasting in the serum or in the blood happens to be lead, which I'll show you in another slide or two. But after a certain amount of days, it's not there anymore. So serum probably should be reserved for acute poisonings. If you think someone's been acutely poisoned, order serum, whatever one you want: cadmium, mercury, lead, aluminum. Other than that, trying to say someone does not have any toxic metal by using serum alone is a fallacy, and probably a big mistake on your part, and it's just going to be corrected by someone else that's going to get it, that's more schooled than you are. So don't let that fool you. Don't use it unless you're using it for acute. It doesn't stay in the system. That's that. Using whole blood or red blood cells. So what's the life of the red blood cell? It's 120 days. in any specific sample. It runs the gamut of 1 day old to whatever, to 100 days, in average probably about in the 90s. So unfortunately, it too may not be the right way to go. So not using the fecal route only because it's more messy. People may not like that. It can be done. And in certain things like organic mercury, it's probably the best route to go. But in general, someone's in your office, you want to get an idea. Do they have 2 or 3 of those toxic metals we talked about before? How do we do it? Well, I do it by doing a urine. Now, in a urine test, you have a choice. You can do either a pre or post type of chelation or what we call challenge test. Now, depends on your state and where you are and what board of medicine takes care of you. You need to check which one is acceptable. It used to be years ago in Florida, the MDs, I don't know if it's still that way, required a pre and you could do the post or the challenge test. DOs, on that other hand, and we're a separate board here in Florida, they could just do the post. So look at your state before you decide which one to do, but let's go through it anyway. No test can tell the total body burden of heavy metals. We made that clear. Please make that clear. If you tell someone, oh, you have tons of it, just saying that is not true. These tests are measuring the amount of metals leaving the body, not the total. That's important. And again, if they're still having other entrances or still putting some of these toxic metals in the system, you'll never know where you're at. So there's 3 chelating agents that we typically use when we're trying to determine a good test: DMSA, EDTA, and DMPS. Let's look at each one of them for a change. So the challenging agents will recreate that bond. That bond is that chelation or that chelating bond. That complex may deplete some essential minerals like copper, zinc, but for the amount you're using for the test, you do not need to worry about giving any types of minerals or anything else for this test at that time. Okay, let's talk about dimercaptosuccinic acid, or better known as DMSA. Now, I use DMSA in my office. This is my go-to for pretty much everybody to do a test. But there are certain things that we need to discuss before we do it. One is, if you notice in the name, this is has a sulfur molecule to it. It's a sulfhydryl containing water soluble substance. So if someone is allergic to sulfa, you don't want to use this product in them. So that would be one reason I'm not going to use DMSA. Okay. So you need to be aware about that. It is absorbed from the gastrointestinal tract, not a lot, only 20%, but you need to know pretty much, is this a male and or females? You can use pretty much the same dose. I make my life easy because I need to make it easy for my staff as well. And what I give is 500 milligrams as the dose. Where do I get the DMSA? Compounding pharmacy. What do? I give it to my patient when they get the test, when we tell them how to do the test. And it does great with most metals, including the lead, the mercury, arsenic. It will pick cadmium, it will pick aluminum eventually. Again, all of these have a dating preference, and we talked about in part 1, which you may want to go back. We call that a pKa value. But for now, DMSA is a easy thing to put. You give the patient the kit and you give them this. Now, how I do a challenge test and a non-challenge test, I will go through right now before we go through the agents with you. So if you want to do a non-challenge test, okay, so you give the person the kit, which is, and it comes with a container to collect all the urine. Remind them they need to get all the urine. If they miss one, test is not accurate. Now, I do a test that lasts between 6 and 8 hours. I find this more than accurate for what I need to know. There are 24-hour tests. I'm just telling you as a clinician, and I always talk to everyone in a clinical manner because it makes sense. You have to think about patient time, your time, and money. So in this case, 6 to 8 hours makes the best sense, and you get a very good result. So what I do in a non-challenge test is very simple. I just tell people, start collecting. from the very first urine, here goes the first urine, collect for 6 to 8 hours. That's a non-challenge test. I don't typically do that because the information I'm looking at or looking for myself, I gain all of that in a challenge test. How do you do a challenge test? Well, I tell them, assuming they're not allergic to sulfa, swallow the 500 milligram tablet of the DMSA. Okay, next step, wait 2 hours. So I tell them first void, they can void here first. Take the 500 milligram DMS tablet, wait 2 hours, now collect 6 to 8 hours. It's that simple. That's how you do a good test. If you're writing it down, do write it down before I go on to the next slide. This is the way that you're going to do pretty much the DMSA test. Now, if I forget, you will remind me, because someone's going to say to me, well, what happens, Mitch, if they're allergic to sulfa? What are we going to use? The answer to is if they're allergic to sulfa, you're going to use EDTA. It's extremely safe. It's in preservative food. We'll get to it in a minute, and I'll tell you how to do it. So pretty much any adult, 500 milligrams is more than enough to do the test. So if you want to figure it out, for example, for an individual, let's say you have a child, you work with some younger people, thinner people, just go 10 milligrams per kilo. So if let's say the person's light and they're only, let's say 40 kilos. So times 10, obviously, 10 milligrams. So you'll give them, again, in this case, you give them 400 milligrams. The problem is you're going to have these tablets made as either 250 or 500. So you have to come in around that area. If you're over a little bit, it's not going to cause any toxicity problems. It's very easily handled and excreted. Let's talk about EDTA for a minute. There are 2 ways you can do an EDTA challenge test. You can use an oral EDTA. And Merit Pharmaceuticals, they're nice people. They're in California. They produce a little 30 lozenges that you can, they're little tablets you can suck on. And what I usually do for someone that's a normal adult, again, male or female, I'll just tell them to suck on 5 tablets with the same exact instructions we did before. In the challenge component, go void, chew your 5 tablets, wait 2 hours, collect for 6 to 8. Same formula to make your life easy. There is an IV form of EDTA test that you can do. And the problem is, before we talk about treatment, if you're doing IV already, even 1,500 milligrams is more than enough. And there are formulas, so you can't just put in 1,500 milligrams. If you haven't taken an IV course, you don't know. We'll talk more about it in part 3 of this. But if those you're doing IV and you know how to mix it properly, a 1,500 milligrams of EDTA will give you the same thing. The difference is when you have IV, you do the following. You tell someone to void, then you do the IV. The minute you give the IV, as you start, now you start collecting. You collect for your 6 to 8 hours because the IV will go directly into the system. EDTA has a 1-hour half-life, and it will be extracting immediately. So with that, you want to have them void before they start their IV. The minute they get their IV, as soon as they have to start going to the bathroom, then you can use it at that point. That's how you use this as well. EDTA does have a high affinity for calcium. So that's why it is used as part of the chelation and the TAC protocol trials and so forth, which hopefully we'll get into a little bit on part 3 of our study program. The next is DMPS. DMPS is, I don't carry orally. It's very hard to find. You can use it intravenously. I used to do it. And for the same reason, I try not to do the EDTA in an intravenous. I don't do the DMPS because it is time consuming. It's time consuming. It's expensive. You, of course, add it into the price of what you're charging for that test, but it is expensive. It also has one big failure, which is it doesn't cross the blood-brain barrier. And it's been approved for mercury for years and years and years. So here's the provocation test with it. Theoretically, you need to stop minerals and sulfhydryl containing supplements.
Is it work bad? Is it what happened?
What's that? You hear me?
Okay.
Hello? Can you hear me? Can someone come on and tell me you hear me fine?
I hear
Oh
you.
my-
Yes, I can hear you fine.
Okay,
It's a
so
stupid webinar. And then
what's that? I
Somebody
think.
is not unmuted, that's the problem.
Oh, it's somebody else talking.
Yes.
All right. Okay. Very good. Thank you. Anyway, hang on with me. We're almost there. So these would have to be stopped for 24 hours. You're theoretically supposed to fast, empty your bladder, and you can use 3 to 5 milligrams per kilo, but no more than 250. There's actually a chart you can make so you can have the age and the amount you want to give that and give it over 20 minutes. It's taking up time of your nurses. It's for this test going to cost a lot more because you're going to have to charge an extra $150, $200 just to make up for nursing time, lights, and everything else, and the DMPS. So I don't use it. I use the other two pretty much exclusively, and you get everyone in. If one's allergic to the other, you can go to the other. I want to make this slide just apparent to you one more time, which shows that if you look at the endocardium, how much oxidative damage is by having mercury in people that have endocardial thickening, as you see in idiopathic cardiomyopathy and dilation, tons of mercury, tons of antimony, tons of arsenic. Again, another reason for you to be checking all the time. So basically, the metals themselves will all lead to reactive oxygen species, as you can see how they do it. These are the vasotoxic ones. And yes, they will attack and create lipid peroxidation and damage to the cell membrane, increase in malinaldehyde. You will get protein abnormality, protein dysfunction. Hence, as we were tying together before, your hemoglobin A1C will be affected. So it does affect the diabetic, or maybe even help initiate it between that and other things. And of course, you have the DNA damage. When you have too much MDA, you will get DNA adducts and impurity by making too much OONO, or peroxynitrate free radicals. So it all pulls together. Toxic metals are dangerous. You need to get rid of them. Now, this is the way a report's going to come back. There'll be 2 pages to the report from Access Laboratories. One is the toxic metals, which you see here on the left side where it says test name. These here are the tests that they're going to run on your patient. I love this test grouping. It's amazing because they're doing things that others don't. One of the most important ones that not all labs do, and hence ours does. And by the way, the turnaround time on this is insanely fast. It's about 48 hours to 1 week the max. But you see, they're doing urine gadolinium, and that is a major problem. It is a vasotoxic metal. It is heavily in patients nowadays because, as you know, MRI scans are done over and over again with and without enhancement, and that enhancement, unless you and just a clinical note, if you get someone that's going, or you must send someone for this, make sure they come in within 24 hours and give them a chelation. And the one for this is EDTA, just so you should be aware. But if you look at this report, you'll see that there are the green, the yellow, the orange, the red, getting more. This is getting more as the line goes up, obviously. It will tell you what the range for the normal is and the units. But as I said earlier, when you look at a report like this, and if this is a challenge test, let's assume, make the assumption, I don't know if this is or not, that this is challenged. If it is challenged, then these numbers over here, the range, is based upon non-challenged. But the problem with not doing a challenge test is if they got exposed and they have lots of it and it's now disseminated into the organs that pick up these toxic metals, then guess what? You won't pick it up by not doing a challenge test, just like you won't pick it up if you do a blood test that we talked about earlier. I hope you get it, because that's extremely important concept. So when people ask you, so what does this tell you? Is it telling you the total body burden? No. Is it telling you exactly how much there is? No. But it is a extrapolation and an understanding. If you see antimony that's way up here, even though this is based upon the other, I tell the patient, look, I can go into a room, there could be 10 children, 5 women, 6 fathers, and I go into the room and I try to pull out a horse. I'm not going to find any horses. But if I pull out 3 fathers, then by definition, most likely, because this challenging agent I gave, the 500 milligrams, is not enough to pull everything out of the body, that there is left behind a significant amount, because this is going to pull a significant amount going to the things that are the highest in the body. So in this case, what I can say by looking at this is that this individual has a decent amount by extrapolation of antimony and arsenic in the system. They have a decent amount of cesium in the system, common. They have a decent amount of mercury. They have a decent amount of platinum, which is very toxic. They have a decent amount of rubidium, which always follows with cesium. And in this case, they do have a certain amount of thallium as well, and there's a drip of lead. But remember, no amount of lead is considered not to be toxic. So they have arsenic, 1. They have no gadolinium. They have a little bit of lead, 2. They have mercury, 3. So they already have, and then 3 toxic metals. And you know by that combination what we need to do and what happens. So when you look at this report, what you're going to show your patients is, look, if we didn't have, you had no barium, for example, we'd pull none out, and we didn't. There's none there. We couldn't get any. If you had no bismuth, we wouldn't get any. If you had no cadmium, we didn't get any. If there is, they're very low in quantities. But look what we took out here with this antimony. No, it's not based on this range, because this is non-challenge range, but on the challenge side of things, we did find it. You can't pull something out that's not there. So for example, I can't pull arsenic if there is no arsenic. I know it's belaboring the point, but you need to understand that, because if you ever get challenged on this test, you need to be able to explain clearly to somebody, doctor, whoever, that this is based upon extrapolation of data and knowledge that even small quantities of these toxic metals are toxic to the individual and toxic to pretty much of all the systems. Okay, so this is our contact information. If you talk to Access, they have urine tests. They're fantastic. They're very easy to get. Your representative would be glad to get them to you. We'll help you in understanding it, and I'm always there to help you as well understand it. So that will be that's the important thing that we need to look at. Let's see if I can get back to go to meeting. Take this off. I'll stop broadcasting. And if you have any questions, I can do that now for you. So anybody has any questions? I know we ran almost a total hour. If you have a quick question, I'll be glad to take that from you. And again, you can always review and get a copy of this. Okay, I'll take that silence as you've got it. And I look forward to you for part 3 coming up next month. God bless everyone. Have a great night. Bye.
Thank you so much.
You're welcome.